John, go ahead, please.
Mr. President, you mentioned the Army Corps of Engineers.
Right.
You've had a conversation with Governor Cuomo.
Right.
He believes that New York is going to run out of hospital beds. Are you prepared to mobilize the Army Corps
we've been asked to
increase capacity?
Yes, we're starting to. We're starting the process, and it's a process. We hope it's not going to be necessary, but it could be necessary.
Do you expect that we could run into a shortage of prescription drugs?
No, I don't see that at all, and I think China has every incentive to make sure that things work well. John?
Mr. President, the governor of Ohio has called off the election that was supposed to happen today, the primary election. Do you agree with that decision, and what steps are you taking to ensure that elections going forward, if this pandemic continues, that elections will be able to happen, including, of course, the big one in the fall?
Well, the governor of Ohio is doing a great job. He called that off, and we'll see what happens. There's a court case, and it hasn't been fully determined yet.
What are you doing to ensure that further elections, if we're still in this situation a month from now, 2 months from now,
what I'm doing, John, is very simple. We're getting rid of this virus. That's what we're doing. That's the best thing we can do.
Just to follow up on John's question, specifically how many new hospital facilities could the Army Corps of Engineers build? And also, what specific measures are you taking to try to increase the number of ventilators in the stockpile?
Right. We've ordered massive numbers of ventilators. We have, by any normal standards, we have a lot of respirators, ventilators. We have tremendous amounts of equipment. But compared to what we're talking about here, this has never been done before.
Our President directed us to work with the Department of Defense. There's two ways that DOD can be helpful in terms of expanding medical capacity.
And are you looking at the possibility of more actions like, for example, limiting travel within the United States? Are you looking
It's possible. It's possible. We'll see how it goes.
Do you need to invoke the Defense Production Act to get more of those medical supplies to different hospitals?
Well, we're able to do that if we have to. Right now we haven't had to, but it's certainly ready. If I want it, we can do it very quickly. We've studied it very closely over 2 weeks ago, actually.
What do you say to people who are not heeding these guidelines from the White House? And then also I have a question on asymptomatic people,
sure.
Dr. Burks.
I'm not happy with those people if they're not. But, you know, those people are being shouted down by other people. They know it. They're being, it's almost like self-policing.
Will the White House put any restrictions on corporate bonuses for companies that do get bailed out like airlines?
I'm going to ask, I think I'm going to ask Mike, answer that question.
I think it's all a work in progress. What President Trump has made clear to industries around the country is that we're going to do whatever it takes.
Larry Kudlow said that there is an idea floating around the administration to cut taxes for companies who would be bringing their supply chains back to the United States. He said he specifically liked immediate 100% write-offs for structures, equipment, but he said you hadn't endorsed that yet. Would you endorse an idea like that?
We're looking at many ideas. That's one of them, frankly, and we're looking at creating incentives for companies, not only that type of company, but other companies.
Have you taken a look at some of these models, such as the Imperial College London model, that kind of poses a very difficult choice, whether it's shutting down society or overwhelming the healthcare system? Is that something that
we've looked at every model. We've relied on the very talented people, and there's no better team than the people behind me, and I will say that all of the people that have done those models are all in constant touch with Dr. Burks and Tony and everybody that you've been hearing so much from over the last couple of weeks. We've looked at many different models, and the model we have is we want to save a lot of lives.
You saw this week, though, that made you decide that, yes, now is the time to implement these much more stringent social distancing measures.
No, I don't think so. This is where we were going. I really think from the beginning, this is where we were going. This is what we had in mind. We're just going step by step. That was the next step, the next logical step.
Follow up, one on the economy and the other on the broader picture here, but just to follow up on my colleague, some people did note that your tone seemed more somber yesterday. You talked about that August timeline. Did you see a projection? Some people thought perhaps that 2 million potentially that could die maybe prompted part of that. Was there a shift in tone?
I didn't think, I mean, I have seen that where people actually liked it, but I didn't feel different. I've always known this is a pandemic. No, I've always viewed it as very serious. There was no difference yesterday from days before. I feel the tone is similar, but some people said it wasn't.
Last one on the economy. economy? Your former economic advisor said almost 100% chance of a recession. Do you see it that way?
It could be. I mean, I don't think in terms of recession. I think in terms of getting it out, because when we're finished with the virus, we will win. We will win. And when that victory takes place, our economy is going to go through the roof. You know, the worst ever, they say, 1918. And I don't have to go into the numbers, but they were unbelievable numbers. Had they known and had they done what we had now, it would have been a very much different story. It would still be tragic, but it would have been a very much different. But that was the one that people write about. That was an incredible pandemic, like we haven't seen. But we have done something that I hopefully we will all have made the right moves. We're all in this together, including you. Let's go back there. Somebody that didn't get one, please. Go ahead.
Mr. President, this has had a huge impact on China's economy as well. Have you received any indication from officials there that they're going to have trouble meeting the purchase agreements, part of the Phase 1 deal, particularly the agricultural buy?
Well, they need our product very badly. And no, I haven't received any. We have good relationship with China. I have not received anything to that. No, we have a signed agreement.
Earlier today, Dr. Birx was talking about the possibility of our hospital system being overburdened, overtaxed, and she talked about certain options that are available to the United States if that happens, including VA hospitals, Department of Defense medical treatment facilities, and even hospital ships. At what point do you tap into those options?
Well, I'll know the point, and by speaking with Governor Cuomo and other governors, we're going to know the point. It's going to be different for New York than it's going to be from, Iowa or from Idaho.
Senator Marco Rubio of Florida, your trade advisor Peter Navarro have been recommending an executive order that would ensure that the raw materials for pharmaceuticals and medical devices are manufactured here in the United States. We were getting some indications last week that you were close to signing this executive order. Can you tell us?
Well, we're looking at different things, John. I don't want to say exactly. Right now, China's been sending us everything we need. But we're looking at some alternatives, yes. We are looking for alternatives.
Thank you, sir. You said Canada has closed its border to non-citizens. Are you considering...
Not to the United States.
Not to the United States, of course. Are you considering closing the land borders in the United States? And also, you've discussed...
Well, Canada has not closed it to the United States. So we're working very closely with Canada. But they have not closed it. They have closed it to the world, but they have not closed it to the United States.
Are you considering closing the U.S. land borders?
I don't want to say that, but we are discussing things with Canada. And we're discussing things with Mexico, quite honestly. And again, the relationship is outstanding with both.
China and others have criticized you for using the phrase Chinese virus. How do you feel about that? Are you going to continue using that phrase?
Well, China was putting out information which was false, that our military gave this to them. That was false. And rather than having an argument, I said, I have to call it where it came from. It did come from China. So I think it's a very accurate term. But no, I didn't appreciate the fact that China was saying that our military gave it to them. Our military did not give it to anybody.
Critics say using that phrase creates a stigma.
No, I don't think so. No, I think saying that our military gave it to them creates a stigma.
Mr. President,
please.
When you speak to travel and tourism executives today, what specific help are you going to offer to them, if at all, or is it still vague?
Well, we're going to help. They need help. Look, let's face it. They go from having record-breaking years. This is the third year of record-breaking years, travel and tourism, airlines, everything. They were doing record numbers, ordering new planes, building new hotels. Everything was really hunky-dory. And then one day, we hear about this rumor in China, and then we find out it's much more than a rumor. The people behind me are total pros. All over the world, they're respected. Dr. Birx, Anthony, who's become a, where's Anthony? He's become a major television star for all the right reasons. No, he's just so professional, so good. The people that we have working here have been incredible. And they're totally respected. The Admiral has been incredible, having to do with the testing. Incredible. And he's viewing this as testing also for the future. We're building a platform. When we took over this platform, first thing the Admiral said was, this was not designed for what we're talking about, millions of people. It wasn't. And it's nobody's fault. It's not like, who could have ever predicted a thing like this? But we broke it down, and it's really going to be incredible system, and it is now a great system. I just want to say these are incredible people standing behind me. They're the most respected in the world. Every country that you've mentioned today so far has called them, and they call them all the time for advice.
Why haven't we seen Dr. Redfield the last couple of days?
I don't know. I can't
He's in
imagine.
Atlanta running the CDC.
I can tell you he's doing a good job. We're very happy with him.
Mr. President, yesterday we were being told that the payroll tax was going to comprise the lion's share of fiscal stimulus.
Right.
We also had the markets fall quite dramatically yesterday, and did that inform?
It wasn't about the payroll tax.
Did that inform your decision? What made you make that change, and when did you make that change?
Well, I didn't make a change. We're looking at payroll tax, and we're looking at various other forms of getting money to people. And the payroll tax is something that I've always liked. The problem is it does take a period of time, months, before they really see something. And we don't really have months in terms of people living. A lot of these, you have people that work on tips. You have people it's a large number of people. It's a tremendous, who would think this, right? And they do nicely. They work very hard, but they work on tips. We have to take care of our people. We don't want to have people suffering during this period. It wasn't their fault that this thing all of a sudden was upon us. So we're looking at we're also looking at payroll tax. It's possible. It's also possible we'll do a percentage of payroll tax and then other things. But we'd like to be able to get money to people. We're very lucky. Our country's doing so well. We can do this, and we can do it easily, but we have to do it. And I have to say, Mitch McConnell, if you look at Mitch and Kevin and the whole group, and it's been incredible how they're reacting, how Congress is reacting, how, whether it's the House or Senate, how they're moving. And I'm talking about Democrats and Republicans, but we've had tremendous leadership meetings, and they want to see it done right. And they do want to go big. I think going big is important. I don't think we want to go up there every day with a different idea.
Mr. President, I want to bring up what you referred to just a short while ago about politics. In your address to the nation, you said we have to put politics aside, stop the partisanship, and unify together. This morning, you criticized the Democratic governor of Michigan. Yesterday, it was the Democratic governor of New York. You've attacked Obama. You've attacked Biden. In fact, every day except one since that address, you've lashed out at a Democratic leader. Are you going to set the example?
I only do that when I have to respond. I watched her on television. She said something that was false, and therefore I did do that. And I will continue to do that. If they're not going to play fair, because, they have the media on their side, I don't. I just have me. And if they're not going to play fair, I'm going to do that. If they are going to play fair, there's going to be nobody better than Donald Trump in terms of bipartisanship. But if they're going to say things that are false, like the story that was written yesterday, a lot of people, I don't know, somebody, I think I know who, but they taped the conference call that I had with the governors. It was a good call. It was fine. I assume somebody's going to tape it. They handed it to various people, and one of them was the New York Times, and the New York Times chose to write totally inaccurately about it. It was a disgraceful thing. It was bad journalism, but, they do a lot of bad journalism. But we respond to that, and actually, people get it. People get it. No, I want it to be bipartisan, and nobody's going to be better than me, but when they attack me or the people, these incredible people behind me, I'm not going to let them get away with it. I can't do that. Okay, how about one or two more questions? Go ahead, please.
Follow up on the 15-day
Please.
guidelines was the next natural step. So is the next natural step after that a national lockdown similar to what San Francisco is doing?
Well, you can do a national lockdown. Hopefully, we're not going to need that. We think of everything. I mean, we have every idea that you mentioned we've thought of, and, it's a very big step. That's a step that... in one sense would work. It's a very big step. It's something we talk about, but we haven't decided to do that. Please, go ahead.
Mr. President, what would be the determining factors for you to take that action?
It would have to get to a level... I just don't think it's going to be an action that we're going to take. I don't think I'll talk. But Anthony, all of the people standing behind me would get together in a room, plus some additionals, and we would make a decision. But I don't think that's a step that we're going to be taking. All right, one more question. You didn't have one, did you? Come on.
Will the U.S. government provide financial assistance to Boeing and airplane suppliers like GE?
We're looking at that. We're certainly looking at Boeing. Boeing got hit hard in many different ways. Boeing never had a problem. For years, they were it was unthinkable what happened with respect to Boeing. Unthinkable. probably, I would consider it the greatest company in the world prior to a year ago. Now they get hit in 15 different ways, and they have different management. I've met the new people running Boeing. I think it's going to be outstanding. But yeah, we have to protect Boeing. We have to absolutely help Boeing.
On what John was saying, you've called for people to leave politics out of this. Joe Biden said the World Health Organization offered testing kits that they had available to the United States, and to give it to us now, we refused it. We didn't want to buy them. PolitiFact says the WHO never made that offer. Can you tell us?
Well, that's what I heard, and I'm going to let Tony answer that question, or whoever's best at answering that. But I do have to say, when you talk about politics, I watched the debate. Not too exciting, but what they said about me, and we've done a great job. When you talk about not being bipartisan, what they said about me, and if you look at swine flu, the whole thing, and I guess it was 2009, and what they did and the mistakes they've made, they were terrible. They were horrific mistakes. 17,000 people died. And I'll be honest, they shouldn't be criticizing, because we've done a fantastic job. The only thing we haven't done well is to get good press. We've done a fantastic job, but it hasn't been appreciated. Even the closing down of the borders, which had never been done, and not only did we close them, but we closed them early. The press doesn't like writing about it. So we've done a poor job on press relationships, and, you know, I guess I don't know who to blame for that. But let me have somebody answer your question.
Yeah, so I tried to cover this in the answer when I talked about quality of kits, and our quality analysis runs through the FDA. So all of these platforms, we have asked people to submit, and we've asked states to quality control. So, I mean, anybody could submit their test to us. We don't buy tests that haven't been quality controlled, and they show us the data. Either show us the data up front or show us the data after they've been running them. Because quality testing for our American people is paramount to us. It doesn't help to put out a test where 50% or 47% are false positives. Imagine what that would mean to the American people. Imagine their level of concern now and telling people that they're false positive. We take this same approach to HIV. Imagine telling someone they were positive to HIV and they weren't. So that is our bottom line, the customer, the American people first. And so any of these groups can submit their testing kits through our regulatory processes. But without that and without a plan, we are not going to accept tests that have not been studied by us.
Good answer. It's a good answer. Would you have something on that?
I'm just going to emphasize a little bit more on that. When I became involved in the testing world, I called as senior officials at the WHO as I could find to understand what the situation was. And as far as I can tell from sources that should know, no one ever offered a test that we refused.
That's what I heard too.
This is a research grade test, right? Research grade test that was never submitted, not approved, not submitted to the FDA. That was supplied in tens of thousands of quantities to 100 countries in the world. Okay, so I think there's a lot that people are saying about this that's just based on rumor and myth. Nothing was offered that we refused. It was a research test that was not approved. And again, there was a small number that we have greatly surpassed in a very short period of time.
So number one, nothing was offered. Number two, it was a bad test. Otherwise, it was wonderful. So listen, thank you very much. No, he made a mistake. I assume that he'll apologize. He made a mistake. Thank you all very much. Thank you. We'll be back. Thank you all. Okay, go ahead.
Mr. President, a lot of people are concerned about how long all of this might last. Do you have any kind of estimate that if Americans really were to band together and do what the White House is suggesting, how quickly you could turn this corner?
My favorite question, I ask it all the time. How many times, Anthony? I think I ask him that question every day, and I speak to Deborah, I speak to a lot of them. I get the opinion. So it seems to me that if we do a really good job, we'll not only hold the death down to a level that is much lower than the other way, had we not done a good job. But people are talking about July August, something like that.
So is this the new normal until the height of the summer?
We'll see what happens, but they think August, could be July, could be longer than that, but I've asked that question many, many times.
Americans today and looking forward are living with so much anxiety and so much fear facing uncertainty right now. I'm curious, how are you talking to your own family about this? How are you talking to your youngest son? Do you empathize with this sense of anxiety? People are really scared.
Yeah. No, I think they are very scared. I think they see that we're doing a very professional job. We've been working with the governors and frankly, the mayors, local government at every level. We have FEMA totally involved. FEMA has been, usually we see FEMA for the hurricanes and the tornadoes. Now we have FEMA involved in this. They've been doing a fantastic job locally. And I've spoken actually with my son. He says, how bad is this? It's bad. It's bad. But we're going to be hopefully a best case, not a worst case, and that's what we're working for.
It's clear some confusion on two key fronts. One is about your own test. The other is about containment efforts. Is the administration considering more aggressive containment options, like a quarantine, a national curfew, restricting
Well, we have that very much. Yeah, we have that very much, and we've been pretty aggressive. We were early with Europe, but we were very, very early with China and other places, and fortunately we were. And as far as containment here, we're coming out with strong suggestions. And, it's becoming a little bit automatic. You look at people, they're not doing certain things. For instance, they're obviously not, I wouldn't say the restaurant business is booming and bars and grills and all. People are self-containing to a large extent. We look forward to the day when we can get back to normal.
To be specific,
what's your second question?
Are you considering instituting a nationwide lockdown, a nationwide quarantine? The NSC knocked that down, but there's still some questions about how it all came
At this point, not nationwide, but well, there are some places in our nation that are not very affected at all. But we may look at certain areas, certain hot spots, as they call them. We'll be looking at that, but at this moment, no, we're not.
The second question is, you said you had your coronavirus test Friday night. The White House doctor's office put out a statement around midnight Friday saying that no test was indicated. So when exactly was your test administered?
Well, I had my test. I was late Friday night, and the reason I did it was because I had no symptoms whatsoever. So the doctor said, you have no symptoms, so we don't see any reason. But when I did the press conference on Friday, everybody was going crazy. Did you do the test? Did you do the test? So very late on Friday night, I did the test. Yeah, please.
Mr. President, you had a teleconference with the nation's governors today. Yeah. And in that teleconference, you told them if they need things like respirators or masks to try to get it on their own. What did you mean by that, and what will the federal government do to help?
If they can get them faster by getting them on their own, in other words, go through a supply chain that they may have, because the governors, during normal times, the governors buy a lot of things, not necessarily through federal government. If they're able to get ventilators, respirators, if they're able to get certain things without having to go through the longer process of federal government. We have stockpiles now, and we're ordering tremendous numbers of ventilators, respirators, masks, and they're ordered, and they're coming, and we have quite a few at this point. I think, Mike, we have a lot. But if they can get them directly, it's always going to be faster if they can get them directly, if they need them. Go ahead, please.
Mr. President, one of the big weaknesses in our healthcare system is surge capacity for medical facilities, and I wanted to ask what precautions, what planning is being done to get China was able to build hospitals in a matter of days. Are you prepared to use the Corps of Engineers or FEMA to start building surge capacity that we may need in a couple of weeks?
Well, first of all, we hope we don't get there, and that's what we're doing, and that's why we're taking a very strict look at this. But we also are looking at areas, and not only looking, we're expanding certain areas. We're taking over buildings that aren't used. We're doing a lot in that regard. We hope we don't have to get there.
Could you clarify something? These guidelines say stay home if you're sick. Yesterday, the Vice President said no one should worry about losing a paycheck if they stay home when they're sick. But the House bill exempts companies of 500 employees or more from the paid sick leave requirement, and that's 54% of the American workplace. Why is it a good idea to only require small businesses to provide paid sick leave?
Well, we're looking at that, and we may be expanding that. We are looking at that. We want fairness. We want it for everybody. No, we're looking at that through the Senate, because as you know, the Senate is now digesting that bill. So we may very well be adding something on that. Okay? Good question.
How many ventilators and how many ICU beds do we have right now, and will it be enough?
I could get back to you with that number. We've ordered a lot. We have quite a few, but it may not be enough, and if it's not enough, we will have it by the time we need it. Hopefully, we won't need them.
And you'll give us the exact number?
Yeah, we'll be
because
able to
so
give
far
you.
they have not given us an exact
Well,
number.
we can give you a number. If it's important, we'll give you a number. Go ahead.
Okay. And yesterday you said that this was under tremendous control. Do you want to revisit that statement if we are going to be experiencing this until July or August, 5 more months ahead of where we are
When I'm
now?
talking about control, I'm saying we are doing a very good job within the confines of what we're dealing with. We're doing a very good job. There's been a tremendous amount of the way they're working together. They're working hand in hand. I think they're doing really a great job. And from that standpoint, that's what I was referring to. Yes,
It's not under, you're not saying it's under control, right?
I'm not referring to it, meaning the. Yeah, if you're talking about the virus, no, that's not under control for any place in the world. I think I read.
You had said it was,
I think I read. No, I didn't. I was talking about what we're doing is under control, but I'm not talking about the virus.
The stock market took another hit today. Is the U.S. economy heading into a recession?
Well, it may be. We're not thinking in terms of recession. We're thinking in terms of the virus. Once we stop, I think there's a tremendous pent-up demand, both in terms of the stock market and in terms of the economy. And once this goes away, once it goes through and we're done with it, I think you're going to see a tremendous surge.
Are you looking at any domestic travel restrictions? I know that's been on the table before, but is that firming up at all?
We're not really. We hope we don't have to, Steve. We think that hopefully we won't have to do that, but it's certainly something that we talk about every day.
Doctors and nurses in this country are telling us across the board that they're terrified of this virus, of the fact that they might get it, of the fact that they might take it home to their families. What can you say to assure healthcare providers in this country that the federal government is doing something today to ensure that they get personal protective equipment to protect themselves and their families?
We are speaking all the time, not only with the people, but also the professional people, the nurses, the doctors. They have been doing a fantastic job. We are also working very much on getting them the kind of equipment that they need, and for the most part, they either have it or they will be getting it. But remember this, we want the governors, we want the mayors, we want them locally, from a local standpoint, because it can go quicker. We want them to work. And we had a great talk with the governors today. I think it was a really great talk. There's a tremendous coordination, there's a tremendous spirit that we have together with the governors. And that's pretty much, for the most part, bipartisan.
You told John that you think this could wash through, as you said, July, August. You just told Steve when he asked you about a possibility of recession, you said it may be. I'm curious, if there is a recession, when do you think that might hit?
Well, I don't number one, determine recession. I just say this, we have an invisible enemy. We have a problem that a month ago nobody ever thought about. This is a very bad one. This is bad in the sense that it's so contagious. It's just so contagious, sort of record-setting type contagion. The good part is the young people they do very well, and healthy people do very well. Very, very bad for older people, especially older people with problems. My focus is really on getting rid of this problem, this virus problem. Once we do that, everything else is going to fall into place.
Last night, a lot of rumors last night that you were going to put in a national curfew or some kind of, texting
I've been
stuff.
reading, I've been watching.
Right, people Me too. Your people were saying this is a foreign disinformation campaign. Is that what's going on? Are people messing with us on the internet?
Well, I don't know. I mean, that I can't tell you. It could be that you have some foreign groups that are playing games, but it doesn't matter. We haven't really determined to do that at all. And hopefully we won't have to. That's a very big step. It's a step we can take, but we have not decided to do it.
Mr. President, two things, one on airlines and one on Jeff Bezos. Can you talk a little bit specifically about what you'd like to do to help the airlines, first of all? And then second of all, we heard that Jeff Bezos has been in contact with the White House daily. Can you say what he's been asking for or proposing?
Well, I've heard that's true. I don't know that for a fact, but I know that some of my people have, as I understand it, been dealing with them or with him. And that's nice. We've had tremendous support from a lot of people that can help. and I believe he was one of them. As far as the airlines are concerned, the airlines, we're going to back the airlines 100%. It's not their fault. It's nobody's fault unless you go to the original source, but it's nobody's fault. And we're going to be in a position to help the airlines very much. We've told the airlines we're going to help them.
They want $25 billion.
Well, we're going to be helping. We're going to be backstopping the airlines. We're going to be helping them very much.
Stocks continue to fall today. Would the White House support negative rates?
Best thing I can do for the stock market is we have to get through this crisis. That's what I can do. That's the best thing we can do. That's what I think about. Once this virus is gone, I think you're going to have a stock market like nobody's ever seen before.
Mr. President, the other day you said you don't take
He'll be back in a second. He'll be back in a second. I think the question that I think maybe John asked about until July, the guidelines are a 15-day trial guideline to be reconsidering. It isn't that these guidelines are now going to be in effect until July. What the president was saying is that the trajectory of the outbreak may go till then. Make sure we don't think that these is solid in stone till July.
Yeah. That would be the outside number. Yeah.
Yeah, Mr. President, these new guidelines say avoid social gatherings in groups of more than 10 people. The CDC's recommendations yesterday were for people to avoid gatherings of more than 50 people. What's evolved in you and your team's thinking in just the past 24 hours? And also, what exactly do you need to see in a stimulus
Well, let
bill?
me just have the professionals answer that. Would you like to do that?
Great. Thank you, and thank you for that question. So we have been working on models day and night around the globe to really predict.
Governor Cuomo of New York said that he believes that hospital capacity soon will be overwhelmed and implored you to call on the Army Corps of Engineers to build temporary facilities to house patients. Is that something
we're looking into it? We've heard that. We've heard it from really two places. There are two places that have specifically, New York being one, and we are looking into it very strongly.
Sir, how have you changed your own behavior to take account of this virus? Are you washing your hands more?
Oh, I've always washed my hands a lot. I wash my hands a lot, probably, maybe if anything more, certainly not less.
What was it like taking the test?
It's not something I want to do every day, I can tell you that.
You had said that in a tweet that Governor Cuomo should be doing more.
Well, I think he can do more.
What specifically
but I think
should he be doing?
I think he can do more, and you know, it's an area of the country that's very hot right now. I think New Rochelle, and a place I know very well. I grew up right near New Rochelle. I think it's an area that has to be tamped down even more, because it's a hotbed, there's no question about it. So I think they can look at doing it, but we're getting along very well. We've had a very, in fact, I noticed he made some statements just now that the relationship with the federal government has been good. The federal government has done everything they've wanted us to do. But we can, I think it's very important that all of the governors get along very well with us and that we get along with the governors, and I think that's happening.
The defense secretary and the assistant defense secretary have decided to separate and be in a bubble to avoid the spread of the disease and to protect the chain of command. Is that something you and the vice president should be doing? And has there been any talk about having to have a 25th Amendment?
Well, we haven't thought of it, but you know, I will say this: that we're very careful. We're very careful with you know, being together. Even the people behind me they've been very strongly tested. I've been very strongly tested, and we have to be very careful. But everybody should be vigilant.
Mr. President, two simple questions for you, Mr. President.
Go ahead, please.
Two simple questions for you, Mr. President. Thank you very much, Mr. President. You already talked. Mr. President, the other day you said that you were not responsible for the testing shortfall. Very simple question. Does the buck stop with you? And on a scale of 1 to 10, how would you rate your response to this crisis?
I'd rate it a 10. I think we've done a great job.
Does the buck stop with you?
Yeah, normally, but I think when you hear the, you know, this has never been done before in this country. If you look back, you know, take a look at some of the things that took place in 09 or 11 or whatever it may have been. They never did. Nobody's ever done anything like what we're doing.
Thank you, Mr. President. How close are you to shutting down America's northern border with Canada? And could you also speak to the fact about the elections that are supposed to be taking place tomorrow? Is it your advice that those states postpone those elections?
Well, I'd leave that up to the states. It's a big thing, postponing an election. I think, to me, that really goes to the heart of what we're all about. I think postponing an election is a very tough thing. I know they're doing because they've been in touch with us. They're doing it very carefully. They're spreading people out at great distances, as you can see, and I think they'll do it very safely. But I think postponing is unnecessary.
On the northern border, sir, how close are you to
We
shutting
think about it. We think about it. If we don't have to do it, that'll be good. We have very strong emergency powers when it comes to something like this, both on the southern and the northern borders, and we are talking about different things, but we'll see. Right now, we have not decided to do that. Yeah, no, the market will take care of itself. The market will be very strong as soon as we get rid of the virus.
Can you clarify about pregnant women? Is that an underlying, because the UK said today that pregnancy was one of those underlying conditions. Do we say that too?
There's very little data in pregnant women.
President, any comment on what people like Devin Nunes, the governor of Oklahoma, have been saying, encouraging people to go out to restaurants, which goes directly against what this advice in your guidelines says?
No, I haven't heard that. I haven't heard that from Devin or anybody else.
Should they stop saying that?
Well, I have to see what they said. But
They encourage people to go to restaurants if they felt okay with their families.
I would disagree with it, but right now we don't have an order one way or the other. We don't have an order, but I think it's probably better that you don't, especially in certain areas. Oklahoma doesn't have a tremendous problem. Oklahoma, you said the governor of Oklahoma.
Devin Nunes is another.
Yeah, well, I hadn't heard that.
So should they be doing that or should they not be doing that?
Oh, it's adverse to what the professionals are saying. That's, you know.
And what you're saying in your guidelines, that people shouldn't be going to restaurants.
But I'll take a look at it. Absolutely.
Telling people to avoid restaurants and bars is a different thing than saying that bars and restaurants should shut down over the next 15 days. So why was it seen as being imprudent or not necessary to take that additional step, offer that additional guidance?
Well, you want to answer that?
Well, I think we have to say the data that has been coming out, and I'm sure you're all up to date on how long the virus lives on hard surfaces. And that has been our concern over the last 2 weeks.
No, I'm sorry. Go ahead.
Okay.
Go ahead. I just wanted to read. There's an answer to this.
Oh, yeah. Go ahead, Tony. He was my mentor, so I'm going to have to let him speak.
The small print here, it's really small print. In states with evidence of community transmission, bars, restaurants, food courts, gyms, and other indoor and outdoor venues where groups of people congregate should be closed.
Are you telling governors in those states then to close all their restaurants?
Well, we haven't said that yet.
Why
We're
not?
recommending, but we're recommending things. No, we haven't gone to that step yet. That could happen, but we haven't gone there yet. Please.
So on the election, you're saying it's a bad thing to postpone it, but if you've got the 10-person maximum, guideline, in a practical sense, can you have rallies? Can you primaries surely gather more than 10 people?
Well, hopefully this will pass through, and hopefully that we'll have everybody will be going to restaurants and flying and being on cruise ships and all of these different things that we do, and it will very, very hopefully be in a fairly quick period of time. But we're taking a tough stance. We may make certain other decisions. We may enhance those decisions. We're going to find out. As per the question that you were asking, some of those decisions may be had.
On the cyber attack on HHS,
Yeah.
is there any reason to believe that they were trying to hack into the system and gather information from the system? And also, is there any reason, so were they trying to hack to get information, and also do you have any reason to think that it could have been Iran, Russia? Do you have any reason to believe it was a foreign actor?
So in the previous 24 hours, we saw a great deal of enhanced activity with relation to the HHS computer systems and website. Fortunately, we have extremely strong barriers. We had no penetration into our networks. We had no degradation of the functioning of our networks. We had no limitation of our capacity for people to telework. We've taken very strong defensive actions. The source of this enhanced activity remains under investigation, so I wouldn't want to speculate on the source of it, but there was no data breach or no degradation in terms of our ability to function and serve our important mission here. Thank you.
What was the upshot of that? And are you still going to be able to meet at Camp David? I think
well, it looks like it.
And are you confident in their responses, as you are with
I'm very confident in they're in a position that some of them are in a rough position. If you look at a couple of them, and some are heading toward pretty rough territory. We had a very good conference. It was a teleconference. Everybody was on the phone, every leader. And almost 100% was devoted to the subject that we're talking about today. And they are working very hard. And they're very concerned, obviously, but they're working very hard. But I would say just about all of it was, Steve, all of it was devoted to what we're talking about.
Hold that summit at Camp David?
I think so. I mean, so far it seems we didn't even discuss that. It's still a ways off, but it was a very good discussion, and they have. There's a great camaraderie. There's a great togetherness. I think I can say that very, very strongly. Thank you all very much. Thank you. Thank you very much.
Very simple question. Does the buck stop with you?
Does the buck stop with you? Does the buck stop with you?
Does the buck stop with you?